Hello ma'am, good morning. I am your Cubero and I'm your student nurse for today. So we're going to perform a body assessment. So our first assessment is we're going to assess your skin, hair, and nails. Okay, we're going to start by inspecting your skin. So upon inspecting, your skin color is brown and even skin tone. You have a flat moles and there are no other lesions found. And now, by palpating, using the back of my hands, determine the temperature of your skin. So upon palpating, the temperature of your skin is normal. And now, we're going to assess the head. The hair is evenly distributed. The scalp is mobile and non-tender. The evenness is silky. The texture and oiliness is silky and resilient hair. And has a thick hair. There are no infections or infestation. Now moving to the skull and the face. So we're going to palpate and inspect. Upon inspecting and palpating the skull is symmetric and skull is mobile and non-tender. The skull is smooth, uniform, and absence of masses and have asymmetrical nodules. Okay, and now let's move to the eyes. So upon inspecting, the hair is evenly distributed, skin is intact, symmetrically aligned, equal movement, the eyebrows hair distribution is intact, no discharge and no discoloration. Okay, moving into the eyelids. Please blink, ma'am. Okay, lids are symmetrical. The conjunction of the eyelids is shiny, smooth, and pink. The cornea is transparent, shiny, smooth, and the details of the iris is visible. And now we're going to use this pen light to know the reaction of the light. The reaction of the pupil is that the pupil constricts. And now, ma'am, please focus on this object. Bringing it close to your nose, your pupils constrict. And when looking at far object, the pupils dilate. And now we're going to assess your ears. So upon checking or inspecting your auricle has the same color with your face. Well, by palpating your auricle is firm and tender. The pinna recoils after it is golden. And the next is we're going to assess your nose. Your nose is symmetric and straight, no discharge upon palpation, it is not tender and no lesions. So please breathe out. So the patency of both nasal cavity, the air moves freely as the clients breathe through the nasal. Now we're going to assess your mouth and or pharynx. The outer lips is uniform in color pink, soft and moist. Please open your mouth. Your gums is pinkish, smooth. The teeth is white and shiny tooth enamel. Please open your mouth. The tongue is in central position. Please move your tongue. The tongue moves freely and no tenderness. And now we're going to use a tongue depressor. Please open your mouth. So upon inspecting, it is pink and smooth posterior wall. And now for the next assessment, it is for the neck. So upon inspecting your neck, muscle it is equal in size. Please move your head, ma'am. Coordinated with smooth movement with no discomfort. So now we're going to palpate your thyroid gland. So upon palpating the thyroid gland, there are no thyroid enlargement or tenderness. And now we're going to palpate your posterior thorax. So upon palpation, the skin is intact and uniform temperature. So there we go. So now we're going to palpate the posterior chest for respiratory excursion. So the movement is symmetric bilaterally. And now we're going to assess the breath sound. So upon checking, it has normal breath sounds. So now, ma'am, we're going to assess your abdomen. So upon inspecting, your abdomen is even in skin tone and unblemished skin. So ma'am, we're going to auscultate your abdomen. So upon auscultating, audible sounds, vowel sounds. And now we're going to palpate your liver. So your liver is palpable. So now, ma'am, we're going to have an interview. So you're going to answer the question with a yes, some sign or no. Okay, let's begin with the question number 1. Does a hearing problem cause you to feel embarrassed when you meet new people?
No.
Does a hearing problem cause you to feel frustrated when talking to members of your family?
Sometimes.
Do you have difficulty hearing when someone speaks in a whisper?
No.
Do you feel impaired by a hearing problem?
No.
Does a hearing problem cause you difficulty when visiting friends, relatives, or neighbors?
No.
Does a hearing problem cause you to attend religious services less often than you would like?
No.
Does a hearing problem cause you to have arguments with your family members?
No.
Does a hearing problem cause you difficulty when listening to the television or radio?
No.
Do you feel that any difficulty with your hearing limits or hampers your personal or social life?
No.
Does a hearing problem cause you difficulty when in a restaurant with relatives or friends?
No.
Okay, ma'am, thank you for cooperating.